It's Friday. That means infectious disease specialist Dr. Zain Chagla is standing by with his weekly update. Good morning. Happy Friday.
Good morning. Happy Friday.
Yeah, let's start with vaccine equity. The WHO Director General this week saying we don't want any more promises. We just want vaccines. You can tell frustrations are very high. What is the problem here with the COVAX is not going to meet its target this year? What are the problems, the obstacles, and the implications?
Yeah, I mean, that's the big part, right? The deliveries to COVAX, the expectation was there were 2 billion doses being delivered at end of year. We're seeing about 1.4 billion, which is, a shortfall of 600,000 people for a life-saving therapy. Add to that, some of the donations that are coming in, particularly Britain and Canada, unfortunately are near their expiry date. And so countries aren't able to even mobilize them appropriately when they get them. Even we dealt with issues getting near an expiry date a few months ago. And so, for a country who's just getting these, dealing with the infrastructure, again, there's challenges. There isn't issues with vaccine hesitancy. There are good studies suggesting vaccine hesitancy in Uganda is lower than the United States. And so, people want the vaccines, but really, this is supply. And as we talk about pediatric vaccines, as we talk about booster campaigns, that's going to eat away at this global supply, which has been compromised because of a number of different factors.
And the WHO is actually calling it immoral, just as the U.S. is about to administer booster shots.
Yeah, I mean, what can you say, right? This is a vaccine preventable disease. It's been 9 months since we had vaccines, and less than 1% of the low income world has gotten a full dose of vaccine as compared to 57% of the high income world, right? So, to let this inequity go on into 2022, when many more people are going to die in the process, I think the World Health Organization is trying to put a line in the sand and tell countries it's time to focus on the world before focusing again on, the vast majority of your citizens. Not people that are elderly, not people who are immunocompromised who may need another dose, but the vast majority of people, right?
Yeah, and it's short-sighted as well, isn't it? Because this is fertile ground with these low vaccination rates in low-income countries for new variants, as if we don't have enough trouble with Delta right now.
I mean, we heard of 2 this week. They're likely not going to be a big deal, but at the same time, they seem to be emerging. The Mu variant from Colombia, the C12 variant from sub-Saharan Africa. These are places where we've had large-scale transmission, poor vaccine rates, and the development of variants, right? And, all it takes is one of these that then is a little bit more evasive to vaccines to then put off our plans to get back to normal. We're all in this together. And again, from a selfish standpoint, vaccinating the world is going to make this pandemic slow down a whole lot faster than revaccinating very low-risk individuals.
Well, you and I are talking about it, but we're not hearing a whole lot about it on the campaign trail. You are actually a signatory on a letter to the Prime Minister and Dr. Theresa Tam calling for a vaccine global strategy. So what are you recommending in this letter?
Yeah, I mean, I think, again, focusing on benchmarks for the world, and again, this is even good political strategy, right? If a country is dealing with a huge issue with a variant and is dealing with healthcare demand and capacity issues, their production capacity goes down, there's increasing political instability, there's economic issues which ripple onto world markets. The next prime minister is going to have to deal with the implications of this in foreign policy and economics. And so, again, we're just saying, for now, focus on boosters for people who it counts, the elderly, the immunocompromised. Don't worry about boosters for the rest of the population, and focus on global benchmarks in order to get vaccines out there. And there are 30 million doses coming to Canada in the next few months. We have to be very careful that there's more doses here than eligible citizens at some point. Whereas, again, places in the world have seen 1% of their population vaccinated.
Yeah. Now, boosters aside, down the road, we have in the news this morning, Moderna is working on a combo single-shot COVID-19 vaccine and flu shot. Game changer?
Yeah, this is great, right? If this works, this is, really, really enhanced coverage. And especially, again, in places in the world where doing a single vaccine campaign is quite difficult, if you can get 3 shots out of it, that's one needle that takes care of 3 diseases: influenza, RSV, which is a major issue in children, and COVID-19. So, there's a lot of hope here to have a single product to do all of this. It's still, animal model studies, so it has to go through phase 1 to 3 trials. But this could change the game, right? You know, bundling vaccines is something we normally do. Kids get 5 shots in a single one as kids just to save visits and needles. You know, to be able to say, okay, come in, you need your flu shot, your RSV shot, and your COVID-19 shot, it's going to have wide-scale implications for disease control, and again, not have to replicate efforts in order to get all 3 of those done at the same time.
Okay, wish we had more time, but that's why we check in with you weekly. But thanks for joining us. Have a great weekend, Dr. Zain Chagla.
You too. Take care, Bob.